Hello everyone, I'm Dr. Farhanta here. I'm a rheumatologist and a pain management physician at Cancer Treatment Centers of America. I made this channel to discuss with you about some latest news about rheumatology, pain management, and one of my other passions is health and wellness. From time to time, I'll try to put some more material and data about latest studies that can help us get us more informed about chronic autoimmune diseases, rheumatoid arthritis, lupus-like diseases, talk about bone and health program, medical fitness, and also how can we stay healthy. And today I picked out about 4 studies for you to hear about. First study is about use of steroids and how they affect in rheumatoid arthritis patients their longevity or cause mortality. This study was published in Rheumatology News magazine, and they reported that glucocorticoid use is associated with greater mortality and cardiovascular risk in patients with rheumatoid arthritis and diabetes together. So mortality means risk of death, and patients with rheumatoid arthritis have higher risk of death to begin with. When you add diabetes in the picture, it makes it even higher risk of sudden death or earlier death. Now, you add steroid to the picture, and actually it makes it even higher. And the numbers are staggering. They looked at that the risk of disease in patients with steroids, rheumatoid arthritis, and diabetes is off the charts. So whenever patients are being given steroids, we as rheumatologists try to use it as less as possible. But if you're ever being given steroids and you think, maybe I should talk to my doctor about reducing the dose, that would be a good idea. It will reduce your chances of having cardiovascular risks. So that was about steroids and high risk of death associated with heart disease in patients with RA and diabetes. Now the second study is the genes and how genes affect our predisposition to develop diseases. So this study looked at the presence of HLA-B27. It is a genetic marker which is found in our DNA, and when we have patients who are positive with it, they have higher chances of having damage to their spine, which is picked up on x-rays in patients who have disease called ankylosing spondylitis, which is a disease of inflammation that affects your spine and your SI joints or your back joints. The third study that I'm going to discuss about is interesting. It talks about that there are some disproportionate number of female authors, meaning we don't have enough leaders in rheumatology who are women and who create recommendations, because when they looked at the number of authors in the rheumatology literature, they found out that women were less than 1/3. Although my belief is that there are many women who work in rheumatology field, but we need to encourage more behavior of leadership and authorship in women, and that would be great. Another study is about diabetes and osteoporosis, and what treatments can we give. So diabetes is a common disease. Osteoporosis, when your bones become thinner, that's also another common disease. And denosumab, which is a drug called with brand name Prolia, is good for patients who have diabetes and osteoporosis, and it can increase their bone mineral density and reduce the risk of vertebral fractures. So something to think about and discuss it with your physicians. And if you are a physician or a physician in training and you happen to follow my channel, it would be good for you to consider it for your patients. Last bonus study, I should say, is how sleep affects our health and heart diseases. We know that it has been recommended that you should sleep on the same time every day and wake up at the same time every day, regardless of it's a weekend or not. And this study looked at changing the regular sleep and wake time by 90 minutes in either direction may increase the chance of heart attacks in patients. So this is something to keep in mind, and I don't know if we should make this a recommendation to our administrators or our leaders, but it seems like changing the time of your sleep can affect your heart in a pretty bad way. So, all right, I hope you found this useful. I'll continue to do my best to put in some more informational material. Okay, until then, have a nice day.